Hello everyone, welcome to Talk Here with Dr. Laz, your favorite health program on television, reaching us from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Yes, on the program today, we'll continue the conversation that we started last week. World Mental Health Day was commemorated a couple of weeks ago. And since then, professionals, advocates, and different persons, carried out a walk in Abuja, Nigeria's capital city, and they raised their voices, drawing attention of government to do more, especially in providing policy framework that is going to guide mental health and the services in Nigeria, and also increasing funding, creating more awareness, and providing enabling environment to ensure that persons with mental illness and awareness for mental health is something that is the way it's supposed to be, actually. So last week you heard from some of the participants at the walk that we interviewed at Unity Fountain, from citizens, psychologists, and today I have in the studio the convener or the founder of Nigerian Mental Health. One of the, actually, I think is actually the lead organization that pulled up other partners and civil society organizations to organize that walk. So he's going to be talking to us for a few minutes. We're also going to hear from a psychiatrist, a consultant psychiatrist at the National Hospital Abuja, before we move to the second segment to continue the Health Agenda 2023. I'll be introducing my guests, but after this short break. Do stay with us.
Health Agenda 2023. The Nigerian health system is becoming weaker with the mass exodus of medical doctors, nurses, and other skilled health workers out of the country. In February and March 2023, Nigerians will go to the polls to elect the next president and state governors, respectively. This provides an opportunity for the election of leaders who will help to strengthen the health sector and reposition it to deliver quality healthcare services at all levels. We present to you Health Agenda 2023, an interview segment on this program for presidential and governorship candidates to discuss their health agenda before the electorates. For sponsorship and participation, reach out through any of the contact details displayed on your screen.
We have come here today to do three things with this walk. The first one is to encourage the National Assembly and the President to pass new legislation on the mental health bill. There is currently a bill that is sitting in the National Assembly. There is a bill sitting in the National Assembly that should be passed for the last 2 years. So we want the National Assembly to send it to the President and the President to sign it. Secondly, we believe that mental health is important. Wellness is important. If you believe wellness is important, say wellness is important. Wellness is important. So our second objective today is to tell you that if you have any psychological or health issues, you can do things like yoga and salsa dancing like we've been doing today. You don't have to always see a psychiatrist. We have to be looking at healing within. The third objective for today is to decrease suicide. Say it with me, decrease. Decrease suicide. Say it with me, decrease. Decrease suicide. If you don't know, Nigeria has the 7th largest suicide rate in Africa. Is it good? No. Nigeria has the 7th largest suicide rate in Africa. Is it good? No.
Welcome back to Talk Here with Dr. Laz, your favorite health program on television. Yes, the first segment will be talking with Chime Asonye. He's a lawyer and the founder of Nigerian Mental Health. You're welcome to the program, Chime.
Thank you so much. Good to be with you today, Laz.
Right. So you probably heard what we just played, where you outlined the objectives for that walk that you guys organized. But one thing that kept, being repeated by the number of persons who talk to us has been the need to pass the National mental health bill,
Yes.
which has been with the National Assembly since 2020. And by next year, you know, this ninth assembly is going to end. So I would like you to speak more about this. The National Mental Health Bill, what are the components of those bills, the provisions, and how is it going to improve the current situation? It's bad enough that we have the Lunacy Act of 1958
Yes.
as the policy framework for mental health, and it has some interesting provisions. So talk to us a bit more about the bill.
Well, first of all, Nigerian Mental Health helped convene amazing collaborators and partners together to do the national, our first annual mental health awareness walk. And I think that the objectives were important to talk about the bill, but also just to get people knowledgeable about that mental health is wealth, and mental health is health. So just getting citizens engaged in the conversation is important because it affects everybody, as you know. But the National Mental Health Bill is something that we need to pass. It's currently with the National Assembly, and a petition over 1,000 individuals have signed asking for them to send it to the president and the president to sign it. And it has a couple of components that are key. You mentioned the Lunacy Act of 1958. If you actually look back, the regulatory framework for mental health in Nigeria actually dates back to 1916. It was actually codified as a law in 1958, but it has British colonial roots, which means that we need to, and yet UK has adopted new mental health legislation. We need to do the same here in Nigeria. Some of the components of the mental health bill have to do with one, human rights framework. So it prevents discrimination from employment, from housing and things like that, which is really key. It allows individuals who have mental health conditions to support their own treatment plans as opposed to it being something that is just given to them. They have autonomy in determining what their treatment plan should be because they are the ones experiencing this. They know what can best help them. It helps institutionally. So it will establish things like a mental health services department. It will also establish
in the Federal Ministry of Health, or
in the Federal Ministry of Health.
In
the Federal Ministry of Health, it's going to establish a mental health department. It's going to establish a mental health fund, which doesn't exist right now. It's also going to help establish a mental health assessment committee that's going to be made up with civil society, psychologists, traditional leaders, et cetera, like that, to help enhance protections for individuals. And I think one of the other key components of the bill is establishing community-based healthcare. Right now, when we think about mental health, it needs to be something that affects individuals at the grassroots. So we should have provisions for this mainstreamed in communities. So the bill will help do that, getting this communities. So this is just some of the things that scratch the surface, but all those steps are key in making sure that there's change in the regulatory framework and that ordinary Nigerians are impacted in terms of the policy guidance and framework for the country.
Okay, that sounds good. You talked about mental health fund.
Yes.
You know, health financing is an area I'm very much interested in. And in many of the health-related bills in the country, we keep talking about fund. There's the Vulnerable Persons Fund, which is part of the National Health Insurance Authority Act. There's even a bill that is asking for establishment of a health bank. So what in the mental health bill, you know, do you have provision on the sources of those funds? Should it be part of the regular budgeting process, or are there specific areas the bill is proposing for the government to make these funds available?
Well, there's different conversations about how the financing can happen. And I think that that's really a government decision in terms of where they want to allocate the funds. But as you know, there's supposed to be a percentage of funds that go to health, right? And some of those provisions of health and primary health care, some of those provisions, for instance, could go to mental health, not just general health in general. So there are aspects of current health financing that could be augmented to help supplement for this. But I think that the important thing is not necessarily where the funds come from, but what the funds are for. I got calls today for individuals asking where they could get pro bono mental health services, because seeing a psychiatrist in the country is difficult.
It's expensive, right?
Some people range it from $10,000 to $40,000. I know some people who pay hundreds of dollars to get mental health services here. So we need people to provide that kind of therapy. Drugs, for instance, is very key for individuals. Rehabilitation centers. Right now, the country only has 8 neuropsychiatric centers, hospitals in the country, only 3 at the state level. So establishing these type of institutions or helplines, for instance, right? There's a helpline that exists in Abuja. You can actually dial it, call 112. One of the partners of Mental Health, the Sunshine Series, is one of the organizations that help put that together. But a helpline supported by government is something that should be cascaded and amplified in different places across the country. So where those finances go are important, and I think the mental health bill will help channel the funds in the right place.
Right. Okay. It's good to know that we have 112 as helpline.
Yes. But it's just in Abuja. It's just in Abuja. So things like Nigerian mental health, one of the reasons we exist is to identify some of these things that can be scaled from our partners. What is working? What do they need? So for instance, 112, there could be more therapists that are involved right now and things like that. We can establish if it works as we continue to test run it. How does that pilot, how could it work in Lagos or in different places in the country? So when we come together as a community of mental health stakeholders and thought leaders, then we can identify some of the solutions and we can figure out what can be scaled and what can be financed.
Okay, that sounds good. Chime Asonye, founder Nigerian Mental Health.
Yes.
It's been a very great conversation. We do hope that some of these interventions, especially the helpline, could be scaled up nationally, and as many persons as possible that need mental health services will be able to access it without much barriers. Thanks for being on the program.
Thank you so much for having me, and happy World Mental Health Day for those who
missed it.
Yeah, and also I hope that they can attend our next walk, and if you don't mind, they can learn more about Nigerian mental health by visiting our website, which is www.nigerianmentalhealth.org.
All right, thank you for that. Thanks for watching. We'll still get to hear from Dr. Shola Oluwanuga. She's a psychiatrist at the National Hospital, Abuja, and she shares some thoughts on what needs to be done by the government of Nigeria to enhance the situation of the mental health in the country. Let's watch her.
Now, to the public, I will say, look after your mental health, be kind to your mind. Don't be ashamed to talk about feelings that you don't feel positive about. Don't be ashamed to ask for help when you are not sleeping well, when you think you are no longer remembering things as you used to, or your thoughts are not, your thoughts are not as clear as they used to be, or sometimes you even feel that some thoughts are being put into your mind that are not yours. Or you've lost interest in life, you've lost interest in living. You think maybe, in fact, you should end your own life. Please, speak up. Speak up, because a problem spoken out attracts help to you. So, when we're talking to the public, we're saying, be kind to yourself and be kind to your neighbor. Be kind to someone else. You notice that someone who used to be cheerful is no longer cheerful. Lend an ear. Ask, is there anything the matter? You're not looking as happy as you used to be, And then also avoid drugs. Avoid drugs, avoid substances that can alter the mind. These things are not healthy. Sleep well. Do everything in moderation. Exercise, walk, exercise your body. A sound mind exists in a sound body. So eat well, sleep well, rest well. Don't kill yourself. Don't overstretch yourself. Take your annual leave. Take your holiday. Don't work Monday to Sunday and Sunday to Monday again. Have a day of rest at least in a week.
Thank you for staying with us. That's the conclusive part of our discussion related to the mental health. After the next break, we are going to take you to the next segment, Health Agenda 2023. Recall that last week we started with the ABGA governorship candidates in Ebonyi State, where they are sharing their health agenda. So the conclusive aspect of that interview, you're going to watch that very shortly. Do stay with us. Welcome back to Health Agenda 2023, a segment on Talking Health with Dr. Laz on AIT. Yes, the first segment we talked extensively with the Professor Bernard Ifeanyi Odo, the governorship candidate of All Progressives Grant Alliance, ABGA, Ebonyi State, Southeast Nigeria. In this second segment, I'll be speaking with the deputy governorship candidate, a health economist, in fact, one of the best in Africa, and also someone with extensive experience in health development and public health project implementation, having worked with a lot of local, states, governments, international, donor, and non-governmental organizations. Dr. Nkata Chukwu. Yes, Prof had provided, he spoke about a lot of things on the health sector. Now, I'm not just speaking to you as a candidate, I'm also going to go deeper based on your background in this area. I read through the manifesto, and the first thing is to have a kind of strategic plan for health sector in the state. And I'm not surprised, having that as number one, given your background in this area. So what are you going to be looking at in that strategic plan?
Yeah, thank you very much, Doc. You know the popular adage that those who fail to plan to fail. So we want to be deliberate about how we tackle the challenges we have within the health sector in Ebonyi.
Right.
Like Prof had already mentioned, we know what the problems are, where the pain points are. But we want to be sure that we're systematic about solving this, because resources are not infinite, and there is also a time issue. Mm-hmm. And even if you have all the money, you will not find all the people and all the tools you need to solve this problem. So the plan is going to allow us to further dissect each of these problems, look at the root causes, mm-hmm. identify solutions, cost them out,
right.
Put some timelines, some responsibilities, and have a results matrix, so that what we're doing for every investment, every intervention in health, we can measure progress and basically be accountable to our people and to our partners who support us. So the plan is going to address each of the building blocks of the health system. Like Prof already mentioned, infrastructure. We have buildings, right. But building is just one tiny aspect of infrastructure. Do we have the right equipment, mm-hmm. the right technology? This all comes into play. Now, human resource is a key challenge. And my principal Prof has already outlined some of our clear targets to make sure that we significantly ramp up the health workforce within the first 4 years, to make sure that we now have as close as possible to the minimum requirements for human resource within each LGA, so that we have doctors for our general hospitals. You can imagine with 6 doctors right now, 13 general hospitals. We basically have less than 0.5 of a doctor per LGA. But by the time we're ramping it up to 50 and more, we have 3 to 4 doctors per LGA, servicing the general hospital and also being able to support the primary healthcare centers. We're going to look at health management information system, which is critical because, like Prof mentioned, we can't tell you right now how many people visit our general hospitals in a day, in a week, in a month, talk less of the primary care facilities. So we're going to have a health information management system built on the already running National Health Management Information System, the DHIS and DHIS2, right? But actually making sure that we deploy this to all the levels. In each facility, there is a health records officer. And some of these graduates, we're saying these secondary school leavers we're going to bring in, will provide support, because it's not possible that in the first year or two we'll have enough money to have all the doctors we need, all the nurses we need, all the health records officers. So we will hire those cadres.
So these are more like ad hoc staff.
These are ad hoc support staff.
The professionals.
Exactly. And remember that these secondary school leavers at some point hopefully will either transition to universities or to learning a trade and all that. But in the interim, and the most important thing is, they bridge that gap between the health facility and the community. Right. This birth and death registration is important for us. And all that is going to loop into the facility health management information system, so that we know what is happening in our facilities. But even more importantly, we also know what is happening in the communities that are hosting these facilities. And we're also going to have in the plan, looking at how do we finance this entire thing, health financing. Our focus is really on ensuring that we have an operational health insurance or strategic purchasing arrangement for the state, where in the first 4 years, we have at least 20% of our population covered under a state health insurance scheme.
Okay.
And to do that, we're going to have a clear framework within that strategy where we figure out for civil servants, what is government's contribution?
Right.
What do they contribute? For people who are in the organized private sector, how do we get money from them? For people who are in the informal sector, how do we get contributions for them or contribute on their behalf? For the poor and vulnerable, what do we do for them? And then the issue of the governance of the health sector. How is the health sector led from the commissioner level to the entire ministry, to the hospital management, to primary health care agency, to health insurance agency, down to the facilities? What is the relationship between all this and how is it governed? Because really without leadership, all these other things will fall. So the plan is going to really itemize each of these blocks, what the interventions are, the thoughts behind it, expected outcomes, and the timelines within which we expect to deliver this, and indicators that people can use people can track. And overall, our health management information system and strategic information system will help us to demonstrate results.
Thank you, Dr. Nkatachuku. Those plans really sound exciting. So now I want to ask you 2 questions. I will ask them together so that you could respond at the same time. So health as a business. A lot of times political actors and leaders see health more from the social perspective, more like humanitarian work, a place you put in money without getting it back. But there's a lot of business opportunities and economic potentials in health, and I know that you're experienced in this area. So what are you going to be doing, your administration, if elected next year in Ebonyi State, to explore this opportunity to ramp up the revenue of the state? Number 2 part is on emergencies. There's a public health emergency, the clinical aspect. What is the plan of the ABGA tickets, ensuring that emergency services are available in the state?
Thank you once again. So we are very deliberate about our entire agenda for Ebonyi State, like Prof mentioned about the B shape. Across all the sectors, the priority sectors we've identified, we have embedded not just the social part, but the business part, because Ebonyi is not a rich state by any standard. So we're being very deliberate to make sure that for everything we're doing, we identify opportunities for each sector to become a net contributor to the Ebonyi economy, and not just the social sector. And that's the case for health. So for health, for instance, I mentioned the state health insurance program, which we're going to completely review and make operational so that what we're doing becomes strategic purchasing, using data to make sure that we deliver to people package of care that really solve their problems. And I also mentioned that we're going to be looking at how to get money. How do we build up the revenue for the insurance, right? Which would include government contribution by individuals, payment of premiums, right? Also contribution from partners, donors and all that, and exploring partnerships with the private sector. Now, when we have an insurance pool, what it helps us do is we're going to purchase services from both the public and the private sector. So it means that as we're getting our public facilities ready, we're encouraging private facilities or private entrepreneurs to set up facilities, health facilities, that we can also purchase services from. And when we have a pool, there is a bit of a guarantee, right? Now, the moment we take coverage up to our 10, 20% and beyond, the demand for health is going to go up, which means we're going to have opportunities to start partnering, and those are some of our areas of focus. We're manufacturing some of the key consumables that are used for health, not only in Ebonyi, the southeast region and all of Nigeria. Syringes, needles, IV sets, cotton wools. Nigeria does not manufacture face masks to qualities that are, where we export to other countries. We want to make Ebonyi a business-friendly environment for health entrepreneurs. We're going to be very deliberate as we link with education and the tech hub to also focus on health technology. People who are, innovating around healthcare and bringing them on board. So we're going to be running massive opportunities for entrepreneurship in health for our people. And on the emergency side, we're going to be deliberate about having basically taken from the national policy to adapt for Ebonyi, a policy that looks at integrated disease surveillance and response, and building up the surge capacity such that whenever this comes, just like what we've seen with Lagos, we're able to respond quickly and hopefully become a model for other states to copy. So we're going to plan for emergencies when there are no emergencies, so that when the emergencies we respond. Thank you very much.
I just want to end this with just one more question to Prof. You know, there is one thing that I've been seeing a lot on social media within active persons from Ebonyi State. They've been asking questions around the fate of Ebonyi State University and medical training in this institution, given that the teaching hospital that was built as a teaching hospital for the State University is now a University of Medical Sciences, which has been taken over by the federal government. Would the Prof. Sodo and Kata administration be building a new teaching hospital for Ebonyi State? If not, what plan do you have?
We will not build a new teaching hospital. It is not economically viable to do that. Under Governor Lechi, we had a teaching hospital that was donated by Lechi to Federal Minister of Health. Professor Yuchichiku was the Minister of Health at that time. A new one recently was built in Nubru, again donated to the federal government. Part of what we intend to do is to review the ownership structure of these two establishments, make it more effective, more viable, so that it can serve our people and serve the need of the immediate community. That, I think, is the best approach in dealing with the issue of teaching hospital. It will still provide the training that is required to our people. We, as states, we're going to sit down with federal government and say, okay, our fund was used to develop these facilities. How do we structure the ownership in such a way that it benefits both the host community and the federal government? I think when we do this effectively, we would have solved the challenge of going to do fresh teaching hospital, which, you know, given the current situation now, it's not economically sensible to do that.
Right.
Yes.
Okay, so what's your last word for any Ebonyian that has watched this program up to this point?
Our last word is that, yes, over the last couple of years, our health has been in crisis. We're offering a message of hope, a message of a fresh beginning that comes with clear planning, clear intervention, and clear focus on what we intend to achieve with measurable milestones, which both we as the drivers of the process and those who will be part of the process will also see how transparent we are about it. So it's basically a message of hope to our people, that things will get better under us. And that, for us, is the key essence of governance, to improve the process and ensure that people get the best for their money and for their time. Now, this is my our concluding statement. So we thank you for the opportunity to be here.
Thank you.
And we're grateful to you. Thank you very much.
Thank you very much, Professor Bernard Odo and Dr. Katachukwu. They are both the governorship and deputy governorship candidates, respectively, of All Progressive Grand Alliance in the Ebonyi State, Southeast Nigeria. And over the last minutes, we'll be discussing their health agenda for the people of Ebonyi State. The decision is for the electorates to make in March 2023. And our job is to continue to bring the candidates to share their health agenda to the citizens. Thank you for watching. My name is Dr. Lars Eze. See you same station, same time next week. Bye for now. Thank you very much, Professor Bernard Odo and Dr. Katachukwu. They are both the governorship and deputy governorship candidates, respectively, of All Progressive Grand Alliance in the Ebonyi State, Southeast Nigeria. And over the last minutes, we'll be discussing their health agenda for the people of Ebonyi State. The decision is for the electorates to make in March 2023. And our job is to continue to bring the candidates to share their health agenda to the citizens. Thank you for watching. My name is Dr. Lars Eze. See you same station, same time next week. Bye for now.